Dr. Amanda from StraightSmile Solutions, and we're going to be talking about elastics today, intraoral elastics. I'm going to be piecing a couple other videos that I already made onto the end of this video. There's a good video about using elastics and aligners that has a lot of the points in there as well. So as long as we're learning elastics, we might as well learn them for aligners and for braces. Same concept, just different way to hold on to them. So, and slightly different strengths. So here's our type it on again. Let's go ahead and talk about the four main elastic patterns we're going to talk about today. And then make sure you take pictures at the end of your module and email them to us of the different elastic patterns that we've asked you to do. So we're going to ask you to do a class 2, a class 3, a triangle, and a posterior box. That's four separate assignments, okay? And each one should have 3 pictures is fine, front, side, side, okay? So the elastics I would stock, okay, would be probably 1/4 inch medium, 1/4 inch heavy, and if you want me to write these down, I can. 1/8 medium, 1/8 heavy, and 3/16 medium, 3/16 heavy. Medium is 3.5 ounces, heavy is 6 ounces, I believe. So that's a total of 6 different elastics, I would say, to stock. I think that's probably all you're going to need. With braces, I tend to use medium to heavy, of course, maybe more heavy if I can. I don't use elastics for class 2, class 3, unless they're in a heavier rectangular wire, okay, not in round wires. Class 2 elastics are going to go, for the most part, from the canine back to the molar, the first molar, but can go to the second molar, okay, if you're trying to get more of a vector of force, but most of the time this is fine, okay. Most patients are probably going to be able to use 3/16, but if they have a really big teeth, you might have to use 1/4. Sometimes you can use a smaller diameter at night and a bigger diameter during the day if they're complaining, but that's pretty much it. Class 3 is the opposite. It's going to go from lower canine to upper molar, okay? So what's the objective of class 2? Class 2 elastics is for overjet, okay? Or if we're trying to direct the space closure in that kind of direction. So if the front teeth are sticking out, we're trying to get the overjet closer together, we're going to use class 2 elastics. Class 3 elastics we're going to use if it's the other way around. Maybe they have an edge-to-edge occlusion, or if we're trying to direct space closure in that direction. You're going to get it eventually, but right now we're going to keep it pretty simple like that, okay? And be sure you stick with us on some of the case selection and treatment planning modules so we can teach you more about class 2 and class 3 elastics. Posterior box elastics, we have some great videos on that already. Those you can use in round wires. I like to be at least in 16 niti in order to use it. Usually I'm going to use 1/4 inch, and you'll see some videos following, but it's going to go canine, canine, molar, molar. Okay? And that's pretty much it, and triangle is right here. So go ahead and practice the 4 different modifications for elastics, take some pictures, and show us what it looks like. All right, and if you don't have a hook, you have to put a Kobe on. That's pretty much it. And today we're going to be talking about bite turbos or bite bumps. We're going to be talking about these because a lot of people are getting these with their braces and they're not understanding what they're for. So you can see here in the picture, these are some like handmade ones. These are made out of a composite material, which basically means composite is like it's not a ceramic, it's not like glass, it's basically like a plastic that can glue to your teeth. So it's not any different from a filling material, it's just that this is made blue so that we can identify where it is, so that we make sure to remove it all. So sometimes you're going to have your bite bumps on your front teeth, sometimes you're going to have them on your back teeth. They may be on the top, they may be on the bottom, you might even get them on your canines. It really depends on the personal preference of the doctor and maybe what they're trying to accomplish with them. So what are some of the reasons you might get bite bumps? Well, the number one reason that people put them on is to prevent patients from biting down on their bottom brackets. Now, not all patients have that problem where they might bite down on their bottom brackets, but some do if their bite is a little bit deep. And do take a look at some of my other YouTube videos to learn more about deep bites and how they're corrected. But that's the number one reason. Your doctor may be of the opinion that you shouldn't have these, and instead that they'll just put the top braces on first and put the bottom ones on when it's time. So that is one opinion. There's really no wrong or right opinion, and people have very strong opinions on this topic. So, you know, don't take it. You can always ask your doctor what they think is best. So what are some of the side effects from getting bite bumps on teeth? So it's important that you do understand the side effects, because if you understand this, you'll be more aware of what's normal and what's not normal. So for top teeth, if you put them on the back of the front teeth, what's going to happen if you get these is that you're not going to be able to bite fully down anymore. That means your back teeth are not going to touch anymore for a period of time until you're done with these. This can make it very tricky to eat. So it's a double-edged sword. Number one, great. You got your bottom braces on. You're not breaking things anymore. That's wonderful. Number two, you can't eat things anymore very well. Soft things, yes. But, like meat or something like that, you really can't chew things up very effectively more. So you're going to have to eat a pretty soft diet until your teeth start to match up again. These may be on 6 months to 12 months, and over time it will get better as your bite starts to change and accommodate for this. So it can be very rough initially, I won't lie. Number two, your front teeth might get very, very sore because you're putting more pressure on them. So you can take some Motrin to alleviate the discomfort. Again, as your bite will start to accommodate, this will start to go away. But you should be aware of the side effects so that you're not pretty shocked. And if you are, first getting braces for the first time, you should, or your child is, you should make sure you have lots of soft foods around the house, Jamba Juice, yogurt, stuff like that, that are easy to eat for patients. Really, really soft foods, spaghetti, stuff like that. So what happens if you get these on your back teeth? It's not quite as challenging to get used to. If you get them on your back teeth, you can still eat, but you can't bite with your front teeth in that case. So, either way, it can be challenging. So in any case, I just wanted to explain a little bit more about bite bumps. If you have any questions, let me know. Don't forget to go to StraightSmileSolutions.com, connect with us on our Facebook forum, both doctor-facing and patient-facing, and submit your questions. We're going to be talking about Class 2 and Class 3 elastics with aligners. And what to do if you're not using Invisalign. Obviously, if you are using Invisalign, it's significantly easier. Here's an example of what their precision cuts look like. You can see here. Can you see it on the canine? I'm going to go ahead and hook that on for you. Now, in terms of what elastics to use, you're going to really have to try them in your patient and see. There's no wrong or right answer to this, and it really depends on the morphology of the teeth and the bite. So let me show you what this looks like. See? This would be for a Class 2 elastics. It just hooks right on there. And then down on the bottom, it's going to go ahead and hook to the lower molar. You can use either the first or the second molar. You could either use a button or you can use precision cut to precision cut. So many, many options. It really depends on your personal preference. So we're going to go ahead and show you a diagram shortly about that. If you're going to go from button to button, you can do that too, actually. You can probably use heavier elastics. You might be able to use 3/16 heavy or even possibly 1/8 heavy. If you're going from precision cut to precision cut, it's gonna be a little bit different. In that case, let me do that for you. I'm gonna set one up for you. You're gonna have to use a lighter elastic. In that case, it's gonna be a little more challenging because you are gonna have to make sure that they're not getting displaced. So let me show you kind of what that looks like. And this is, I'm using a combination of ClearCorrect and Invisalign. So that's going from slot to slot, okay? So that means the patient is gonna go ahead and assemble this outside the mouth and then put it in their mouth all at one time, as opposed to going from button to button where you're gonna put the aligners in first. The buttons will already be on the teeth and then hook the elastics on. So personal preference, what you wanna do. What if you want to go ahead and punch your own precision cuts? Now, again, we showed the demo of Invisalign, what it looks like. The good thing about Invisalign is because of their scallop trim, it's super easy to put the hook on and they're relatively low profile. If you're going to punch in your own, it gets a little bit uglier, and you'll kind of see what I'm talking about, because if there is no scallop trim, when you try to punch in your own, it's not going to work. So you're going to have to create your own slot. So let me show you what this looks like. You have to play with it a little bit, but this is for the Class 2. You can see here. So what I was using to do that was, I'm going to give credit where credit's due. So the pliers that I was using, these are made by Justenko. It's a company out of Sweden, and you can see here, this is the slot puncher. I have a couple other videos on that. If your aligners have straight line trim, like ClearCorrect or some of the other in-house aligner white label companies, you are gonna have to get creative with your punching. This is how you do the molar punch out. That's a little bit easier. You can see here, I'll show you what that looks like. So here's where I did a molar punch out down here, okay? And really I would put it on the patient first, you know, and just kind of mark where you wanna do it. It needs to be in the center of the clinical crown, and you need to be able to get the whole button on there and a tiny bit of enamel along the gingival so that it's not kind of seeping on the gingival as you bond it, because it's probably not going to stay on. So you need to make sure you make it high enough. This is probably an example of how not to do it, because it's a little bit off center and I think not high enough. So I'll try to reposition that for you. But okay, so let's talk about the opposite. So here we go, I'm popping it right now. Woo, that's a little bit better. Okay, maybe a little bit more centered, okay? What if you want to do a class 3 elastic? Class 3 elastic is the opposite. So you're going from, and we'll go ahead and show you a diagram now. We're going from upper molar, so you can either do the 6 or the 7, so you have to think about that, to the lower canine for the most part. So it's opposite, right? So upper molar to the lower canine. Let's see if we got one punched out here. Nope. Yes. So here. This is actually an upper now. We just turned it into an upper. So there's your upper molar cutout, or you can do a slot. I'll make a slot for you right now. You can see how to do that. Again, these are not the prettiest, but I do find that when you have a straight line trim, you're kind of at a disadvantage for this. You really are. Let's do that here. Sorry, I'm not really doing it in front of you guys, but okay. So I kind of ran it to the 7 here, but here, this is for class 3. So upper molar slot down to lower canine. If you want to go slot to slot, you're going to have to go lighter on elastics. If you want to go button to button, you can go heavier on elastics. Again, the elastics I'm usually using are, on the small end is going to be your 1/8 medium to 1/8 heavy. On that larger end, maybe 3/16 to maybe 1/4. Depends on the morphology of the teeth, the bite, the patient's musculature, so many things. So you really need to try in the elastics before the patient leaves the office and make sure that they can comfortably get them on and get them off in a timely manner. I'm going to give them about 1 or 2 minutes. If they can't do it in 2 minutes, you know, either have them practice more or change the elastic size. If they cannot do it, then they're not going to do it at home, because I mean, and you guys should be able to do it too, I'll be honest. I mean, initially, unless you have nails, you're probably gonna use one of these to put the elastics on. But if you can't do it with your nails, the patient can't do it with their nails, okay? So, and the patient's not gonna take this home. I mean, there's elastic hook, things that you can use it, but realistically, is the patient gonna carry that around? No. So make sure it's something that you can do before you assign it to your patient. In order for elastics to work, some tips, you have to wear them 24/7, 24/7. Maybe you can have maximum 2 hours per day while you eat. If they are only wearing them 18 hours a day, it will not work. You will get 0 outcome on this. So it's like a seesaw effect. It's just gonna be sore. That's the only thing that's gonna happen. So you have to make sure that your patient understands this 24/7. And not just 2 weeks, 3 weeks, you're talking about months to get, I would say if they wear it aggressively, and you did right by your sizing, you should see about 0.5 millimeter to 1 millimeter a month of AP change. By AP change, I mean the bite correcting from the anterior posterior direction. That means if they have a 7 millimeter overjet, it's going to take at least 7 months to correct that. I mean, that's even on the max. I don't know in an adult if you're gonna get that much correction. That's maybe in a kiddo. In an adult, the max you're gonna get with elastics is probably 2 to 3 millimeters of correction, and that's if they're awesome. In a kid, maybe you can get up to 6 to 7 millimeters, and that's if they're awesome. But like I said, that's gonna take minimum 7 months of 24/7 wear. When the patient comes in for their checks, you need to be measuring them and taking photos. You should see, if you're only seeing them every 6 to 8 weeks and they're honestly wearing these 24/7, you'll see a change. If you don't see a change, they didn't wear them. So, and you need to be confident in telling them that. So, I mean, a little confidence with elastic goes a long way, because, patients or kids are like animals. They can sniff out fear, and it's a lack of self-confidence. So you need to have the confidence. But again, if you didn't size the elastics right, guess what? It's not gonna work. So it all comes down to whether you sized it right. So hopefully I didn't blow your mind too much with these instructions, but there's an art to wearing elastics and there's an art to getting a good outcome. So Any questions, feel free, send your questions our way. StraightSmileSolutions.com. We'll be glad to help you with aligners and elastics wear. All right, thanks so much. And today we're going to be talking about Class 2 elastics. I'm directing this kind of series of videos really towards the general dentist, towards the pediatric dentist, doing some, fixed orthodontics, maybe has some questions. I tried to Google search out there to show my clients, and there's really nothing out there. So basically, a lot of questions I get are, what's a Class 2 elastic? You can see how the orientation goes. In general, it's an elastic that normally hooks from the upper canine to the lower molar to correct an overjet. The actual size of the elastics is going to really vary. I'm talking about the diameter is going to vary on the amount of overjet or the size of the teeth. So you really should stock several sizes. I would recommend stocking 1/8, 3/16, 1/4. Those are some good ones to stock. Then there's also strengths. Normal Class 2 elastics, I'm going to use 6 ounce, but it also depends on what wire I'm on, and we can go into that more later. So do message me, visit StraightSmileSolutions.com if you would like some more suggestions. But normally I'll run my elastics on a heavier wire. I'm not going to run it on an eye-tie wire. It's going to be a stainless steel wire. I know that's really different than a lot of other IDB systems that are out there. And I'll run 3/16 heavy. But again, you got to stock lots of sizes. It's not a one-size-fits-all approach for elastics. There's some thought that needs to go into it. Do not run it on a light wire. All sorts of crazy things are going to happen. And that's basically all about Class 2 elastics. Take them on, take them off. Every time you eat, they absolutely have to be on 22 hours a day. No ifs, ands, or buts. If the patient only wearing them 12 hours, 16 hours a day, they're not going to work. There's just basically a seesaw effect, and there's going to be significantly more discomfort. So if you do not establish this with the patient and the parent, at the beginning, they're not going to see success. You should, I'm going to say confidently, you will see a change if you're seeing them on 6-week intervals and they're wearing elastics. It will be evident, okay? It should be quite evident, as a matter of fact. So if you're not seeing the change, you need to be confident in saying you're not wearing them enough. They may be wearing them 16 hours a day, but you need to troubleshoot. That means they need to be changing the elastics at least 4 times a day. Every few hours, they should be changing it. Usually I say 4 times a day: breakfast, lunch, dinner, snack. Bedtime, that's 5, something like that. It's okay to change it more. You should be dispensing at least 2 bags of elastics every time that they come to the 6-week interval check. So, and remember, as you're correcting the bite, the wires are gonna get pokey. You gotta trim it, right? And you still gotta check the patients. So yeah, that's all about Class 2 elastics. And I get this question a lot with my customers, with my doctors. They ask me a lot about rubber bands, especially the patients, whether they're Invisalign or they're in traditional braces. The question is, what size, what orientation should I prescribe for rubber bands? What's the best way to wear them? How do I know if it's the right size? So I'm going to take you a little bit through some rubber band formats and see what you think. So here, it doesn't matter what kind of rubber bands you use. There's all different ones. The main thing is you want to make sure that they're new rubber bands, because over time, rubber bands do degrade. Here, I'm using Ormco brand, but many different options out there. These are the colored ones. I would recommend latex rubber bands. They're a little stronger than non-latex. Of course, if you have a non-latex patient or latex-sensitive patient, that's a different story. But from there, basically, some of the popular ways that you would wear rubber bands. Let's start today with, say, box elastics, okay? That's a popular one to try to settle the bite. So go ahead and take a look here. If the bite is a little open or deep, a little bit deep, and you maybe have some bite ramps back here, you need to settle the bite. You usually will wear them from the 6s to the 3s, basically making a rectangle. How to pick the right size? Goodness, it really depends on the bite of the patient. It really depends on the teeth. But ideally, it's best to find the smallest possible size that the patient can comfortably take on and off. And if the patient is in between sizes, usually I recommend maybe picking a slightly bigger and a slightly smaller size. They can wear the bigger one during the day, the smaller one at night. And I'm talking about diameter right now. I'm not even talking about strength, okay? Because there's a whole grid. They come in different diameters and different strengths. So you can go ahead, and for these, usually I use, you can use 3/16, you can use quarter. Right here, here's a 3/16 right here. This is a little bit heavy, okay? So now we're gonna talk about strength a little bit. This is 6 ounces. 6 ounces is a little bit too heavy if you have a light wire. So I wouldn't recommend it necessarily if you're in a light night tie. But this is what I have here. So we're gonna go ahead and show you how to put them on. You know, the patient shouldn't walk out of your office until they can comfortably take the rubber bands on and off a few times and show your assistant that they can do it, okay? So there are little hooks to help you out, so you can give the patient those. You know, it's a little harder to do it on a typodont sometimes, but nails do help. And there we go. There's a nice little posterior box elastic. And if you have the hooky, it helps more. Just make sure the patient can comfortably do it, show it a few times, give the patient time, don't stress the patient out. On, off, okay, you're great. If it's a child, show the parent that the child can do it. They need to wear these elastics, usually on both sides, 22 hours a day, minimum. That means they're in all the time, unless they're eating. As soon as they're eating, they're brushing, they're putting them back in. Another common question is, how often do you need to change the elastics? Well, pretty much every time you eat, you should be discarding your elastics, which are now overstretched, and putting a new pair in. So that's at least 4 times a day. So if you're seeing your patient every 6 weeks or so, you should be giving them 2 bags of elastics. They should blow through those pretty quickly if they're wearing them right. If the patient's actually wearing the elastics, you will see a dramatic change in the bite by the next visit. If you're not seeing a change in the bite, they're not wearing them right, or they're not wearing them as much. The thing about elastics is if you wear them 16 hours a day, it doesn't work at all. You have to wear them that 22 hours a day. There's a sweet spot in there, where otherwise you're basically just rowing a boat. You're going forward, you're drifting back. You're going forward, you're drifting back. So anyways, that's what I have to say about posterior box elastics today. Stay tuned.